Good morning, everybody. Welcome to today's Oncology Data Advisor interview. Today, I have a special interview planned for Breast Cancer Awareness Month this October, and I'm joined by two of our editorial board members, Megan Claire Chase and Dr. Jasmin Hundal, and our guest for today, Kisha Cummings. We're really excited today to have them all on and to hear their insights and their experiences. So with that, Jasmin, I'll turn it over to you to start off some introductions and then get into the conversation.
Thank you so much. So, hello everyone. My name is Jasmin Hundal. I'm a current third-year hematology oncology fellow interested in breast oncology and survivorship at the Cleveland Clinic. I'm really excited for this interview as well as the month of October, right, as it's Breast Cancer Awareness Month. And I'd like to welcome Kisha and Megan Claire today to the interview, and I'll hand it over to Megan Claire to give a little introduction.
So, yes, hello, everybody. So, yes, I'm Megan Claire Chase, but in Cancerland, I am known as Warrior Megzi, and I will be a 10-year invasive lobular breast cancer survivor come March 28th, because I do it by when my cancer was actually taken out. And I'm also a writer, patient advocate, and then professionally, I'm also a director at a national nonprofit.
That is amazing. Thank you so much for sharing. And then the countdown starts, right? Like March cannot come sooner.
I mean, for real, right?
Yes, we
Countdown for
definitely have to
May.
celebrate. Yes, for sure. How about you, Keisha?
I'm doing good. Good morning, everyone. Thank you for having me here. My name is Kisha Cummings, or La Keisha Cummings, and I am a 5-year, 6-month, and 2-day triple negative breast cancer thriver. Before cancer retired me, I was a registered nurse working in the recovery room at a local hospital here in Atlanta area. And since then, I've become a patient advocate and been able to connect with a lot of amazing organizations that has allowed me to be a part of a cancer advocacy team, cancer care policy advocacy team. And we lobbied in Capitol Hill. And I was also able to be a part of an organization here in Atlanta called Bridge Community Forum, where they're out of Emory University, and I was able to represent them at SABCS, where I met Megzi at. And I like to say my most important role is being a mother to 3 amazing children. So that's a
That
little.
is amazing. Thank you so much for sharing. That's great to hear. So I'll start with you, Keisha. So how was your transition from, you mentioned you were a nurse, right? So you see medical care, like, you're in it, and then transitioning from a role of a caregiver, right, to a patient. Can you share a little bit about how you felt in that time and how it has shaped you over the years to kind of like transition from multiple roles, right? Like being a caregiver to a patient, now to a thriver. So if you can just give us a little insight to that.
Well, I guess from my point of view, my sister raised me, and she passed from breast cancer 2 months before I was diagnosed.
Mm-hmm.
So I was really numb and just, in robot mode, basically. So
Yeah.
everything just seemed like a whirlwind. I came back home, and then, I was having some medical problems with my back, and I saw my gynecologist about that. And then I ended up finding a lump in the shower right before I had my appointment there. So, so I talked to him, I said, well, I just had a breast exam and everything was fine. My mammogram was fine and everything. It's probably nothing. So then, he felt it. He was like, well, let me send you over to a buddy of mine just to make sure, since it's in your family, and just, with my sister recently passing. So he sent me to his buddy, and it was just like a whirlwind. He said, you need a biopsy, you come back Friday, then I get the results 2 days later. It was just like a whole whirlwind. But in that, I felt like everything was rushed, but also no one explained anything to me because I was a nurse. So, they're figuring that I know all these things, which I didn't. That wasn't my specialty. Oncology was never my specialty. So I felt like, just looked at that and felt like they didn't have to explain things to me.
Yeah, no, I thank you for sharing. That was definitely very, very powerful, like kind of left me speechless. Yeah, you're right. Like, being in healthcare, being in patient shoes from a caregiver shoes, I think that it's difficult from a patient perspective, but also from a physician perspective to, how much do you want to explain, like language, right? Like what kind of language are we going to speak? And I think in the past from my mentors, what I've seen, if you do see medical healthcare professionals, right, coming or becoming a patient, I think what has worked the best, I feel like, has been like, a communication right at the beginning of the visit. How would you like me to convey and discuss the diagnosis, the treatment plan, and the prognosis and whatnot? Would you like me to, discuss it? Because, there's sometimes family members there, or the background might not be even, how about a dentist, or how about like somebody who doesn't like have an internal medicine or an oncological background? So I feel like setting the stage, I think, is so important. I know in Maxi, right, we talked before too, like the introduction, if we see a patient, instead of saying what brings you here, like just saying like, like I'd like to know from your own words, like what would you like to address today? So I think the communication is probably very important. And I'll give it over to Maxi, what from her perspective going through this and from her experience and what she has heard, if you can provide an insight to how, from a patient advocate perspective or from a patient perspective, what is, I think, the best way to go about this?
Well, I think one of the big things is, doctors are often scared to overwhelm the patient or scare the patient. But when you're in oncology and it is literally your life, I think it's important that they all assume that we know nothing and that we need to be educated, like just period. And, something I've realized too throughout this is they're not also understanding like the impact. Like, take a pause, because part of my story and part of my advocacy, so for me, I was ignored for over 2 years. My symptoms presented differently, and I think that's really important to bring up, because I don't like saying breast cancer awareness. I like saying breast cancer education, breast cancer action, because that health literacy, and what Kisha just said too, it's like we're hearing all this new terminology and we're trying to process it in real time. But as Kisha said, and the same in my case too, everything goes very fast once you officially get that diagnosis. And, I distinctly remember the first visit with my oncologist, and I was with my mother. Now, my mother also has cancer. My mother had ovarian cancer when she was 28 and pregnant with me. So it's like a miracle that I'm here. My parents did IVF. It took them 8 years to even get pregnant. So I always knew I would get cancer, but I knew nothing about breast cancer. I knew everything about like ovarian and cervical, because that's where all my issues were. So going in there and being told, okay, you're going to need 16 rounds of chemo. And do you want to freeze your eggs? Like, she didn't even like take a breath. She didn't even blink. And all, of course, what do you think I focused on was chemo. I'm not thinking of my fertility in that moment. I'm thinking, how am I going to pay for this? How am I going to survive this?
Yeah.
And I'll always like, I still feel some resentment with that, because it was not explained to me, or I didn't know if there was even a window of saying, hey, you know what? This was a lot of information. I wish someone had followed up with me as well, because I think that's part of the issue too, in that communication with patients. Like, okay, maybe the doctor doesn't say it in the greatest way. You're also hearing a lot of new information that's scary. So why not the next day, whether it be an oncology social worker, a patient navigator, someone else calling and saying, hey, you just heard a lot of information that was probably very overwhelming the other day. I want to make sure that you're understanding what comes next. That's what needs to happen.
Yeah, agreed. I feel like communication is really, really important. I mean, like no matter what. And I feel like everybody's so different. I feel like it's just hard to master it, right? But yeah. So moving beyond the communication in terms of like since diagnosis and thriving for so many years, what has helped you most to go through the uncertainty, right? For example, in triple negative breast cancer or in a lobular breast cancer, both journeys are quite different, right? Because the treatments are different. The prognosis discussion is different. The landscape of evolving treatments is different. So I'd love to hear from both of you how over the years have you felt, specifically with triple negative breast cancer space changing their treatment paradigms right over the years, as well as with lobular or even being lobular breast cancer patient and survivor and thriver. I feel like that has different implications because lobular breast cancer is also very 1 out of 10 patients, like it's just 10%, right? And maybe more perhaps, and then maybe it's underreported, but for now that is what we know. So whoever wants to start first, I'll give it over to you and would love to see how you feel about overall the past years, 5 years and then 10 years for Mexi.
Kisha, take it away.
Well, for me, I feel like that first year, I did see a lot of doctors. I had, like Megzi, I only had 8 rounds of chemo, but I had 7 surgeries within the past 9 months. And it seemed like within the year, it was 2020 during COVID, the heart of COVID. So with that, in that time, I was constantly seeing all types of doctors, specialists, things like that. After my last surgery in December of 2020, I saw my oncologist, surgeon, primary care. And then it seemed like it just started dwindling down. And it's just like, then I started not seeing anyone. So I kind of felt like I was dumped,
Mhm.
kind of I did. It was like I went through a divorce because it's like, here we are, we're together all this time and we're going through all these life-changing things. A lot happened in, that time that I was diagnosed, and the doctors were always there. But then now it's after the fact. Now I have to deal with my body changing. I have to deal with my mental changing, my emotions, just the dynamics of my home, because I'm a single mother, so I'm the sole provider, so just having to deal with all that and not having support in that, you know um talking to my doctors about just different issues that I'm having mentally or physically, and oh well, I didn't give you any physical therapy. I'm like, no, you didn't. Or with mental, instead of, I asked them, I said, well, I really would like to be referred to mental health, because I'm really going through, some mental changes now and I know it. Oh, we don't have anybody in the breast cancer space for that. We, just have regular therapists. I can refer you to someone like that. But it was like I was advocating it, but they were just pushing me to the side. So I had to take, a lot of things into my own hands. Just even with my diet change, things like that, that started helping me. I started meditating. My daughter started juicing for me because my appetite was just gone. I didn't, have any appetite to eat anything. So she started doing that for me. And I just started doing things that way. And then when I would speak to them about, that again, they will shame me on my diet, with, well, I don't feel like your diet, you shouldn't just stop eating meat and dairy and everything. I'm worried about your protein, and so it was just things like that. And even with the meditation and things, well, I really feel like you should try to go to a therapist, but I did try, and it was a guy, and he didn't deal with the issues that I needed to be dealt with. And that's why I was looking for someone that was more, in the cancer space of helping me deal with these, body changes that I'm dealing with, and, things of that nature. So I just felt alone after that. And honestly, it's still that same way.
Mm,
Mm-hmm.
mm.
Yeah, the body changes and the transitions, and there's so much more to the chemotherapy related side effects that we know of. Because I think a lot of things that we don't discuss enough, I think, is body image and how the body reflects and looks to you after this treatment. Because even like in research wise, I have to like now look into it because I really it's been in my mind, but I really never like looked much into it. What is being done there for body image, right? Like how do we discuss that? And then I do know like now slowly but surely we're getting a little more support in terms of like menopausal symptoms and whatnot. But I think body image, curious Maxi, has ever anybody talked and discussed to you about body image, body changes during and after treatment?
Um, for me, no. Um, well, my plastic surgeon, he was phenomenal. I think he
Mhm.
told me certain information, but I couldn't process it at the time. Because I remember going to him, I actually had a lot of complications, and I just wanted to say, Kisha, you didn't just only have 8 rounds of chemo. You had chemo, period. Like, that is toxic. Doesn't matter if you had 1 or 8 or 16. Like, right. So we'll make sure I call that out now. But I remember going to him, and I was like, so when are these scars going away? I was like, it's not healing. And because I was just like, oh my gosh, because I did have a lumpectomy. Well, actually, they took a whole quadrant out. And so I ultimately ended up turning into a mermaid. And you could hear me swishing because normally you do not need drains when you have a lumpectomy or a quadrantectomy. And but I had to be aspirated. We had to aspirate over 455 cc's of seroma, which is fluid. And so during that time, I was like, when are these scars going away? I was like, I don't seem to be healing. And he took my hands. And again, Kisha and I are both from Atlanta. And I had one of the top plastic surgeons for those who are diagnosed under 40. Dr. Mackay, I'm gonna give him a shout out. And he took my hands and he goes, you remember that movie Titanic? And I was like, yes. And I was like, don't tell me I'm going to be Rose or Jack and I get tossed off the door. And he goes, no, I want you to think about that iceberg. And I was like, yeah. And he goes, you know how massive that iceberg was on top, right? And I'm like, yeah. He goes, so now your breast cancer and your surgery, think of how massive it was below that. That's how
Mhm.
much we took out of you. So these scars that you have are forever. And I just like looked at him and I was like, for forever and ever. And here I am, soon to be 10 years later, and they're still there. And for a while, I didn't wear V-neck shirts because I had the port scar, and that's not fading. And people would look at me, but now I wear it, I don't even care anymore. But I do still have a hard time looking at my body because I did have to get surgically moved into menopause, and I had to get a hysterectomy and an oophorectomy. And I realized so many people don't even know what an oophorectomy is. Like, they had to take everything out, not just my uterus, it was my ovaries, it was my cervix, it was my fallopian tubes, like everything that
Mhm.
biologically made me a woman,
Yeah.
because my body had difficulty accepting the medications I was supposed to take post treatment. And uh, for those listening, Kisha and I are fabulous, brilliant, beautiful Black women. And I often have to remind people that we're sometimes walking clinical trials. And that's how I realized, hey, some of these medications, they didn't have enough representation of people that look like us. And so to have to go through all of that and physically feel your insides shifting because there's so much room in there because all of the things that biologically made you a woman are gone just so you can quote unquote survive. I didn't get support with that because it was more like, we're trying to keep you alive. But as Kisha was saying, it's like there's no one there to help with like improving your quality of life. We're not giving like those resources. And if you don't know what search words to use or even like where to go, how are you supposed to know that?
Mhm. Yeah, no, very, very, very true. And the representations of clinical trial, we can go on and on with that topic, right? In terms of like how important that is. And hopefully we're making strides, right? I feel like with patient advocates, just like you being there, working with everyone with industry, with providers and everything is very, very important. Yeah. I guess I'll leave it up to you both. Like, what else do you guys think is really important to know and discuss that you guys think that is not discussed enough? Especially during, this month of October. I feel like there, as Dr. Plinsky also puts it, into pink washing, right? There's a lot of the use of just pink ribbon everywhere, right? Like whether it be from a fast food chain or a clothing store.
Mhm.
How does that feel to you? And especially like, do you think that the people that know you, like acquaintances, friends, family, during this month, do you feel a change in interactions? That's one of the questions. And then second question is, how do you feel with so much awareness and so much going on, just pink all around? How do you feel as a patient, as a thriver?
Well, for me, no, I don't think anybody says anything different or treats me any different because it's October. Um, I guess it's a little bittersweet for me. It's nice to, bring, awareness, education, resources to the forefront in the month of October, but I have to deal with this every day.
Mhm,
I wish that it was only allotted to October that I have to deal with, forgetting where I put my keys at or forgetting where my glasses are when they're on my face or, or just anything like that. So I think with that, it makes me feel some type of way because I'm like, we deal with this every day. And you just see it in October to say, oh, Breast Cancer Awareness Month, we're here, we're supportive of you. I'm just like, okay, well, where's the support at now? Where was the support
mhm,
then, all this money that they raise and things like that, where did this go to? Did you use this research to, like Megzi, I also had a hysterectomy and basically everything, a total hysterectomy where they took everything out. So it's like, where's the research for this at to tell me that now I'm in early menopause, now I have all these mental and body changes and, things like that. What are you doing with all this money that you use me as a poster child for? So,
mhm,
Mm. I
yeah.
hear you. I hear you on that because it's like all the commercials we see, right? Everyone's smiling, high-fiving, wearing tutus. And again, I'm not saying that to stomp on anyone's joy. And I
mhm,
think that's what's important, but recognizing that this can be very complicated. And especially during this particular month, for those who did not bounce back the way some others did, right? Because
mhm,
everybody is different, everybody heals differently. But for some, like me, even as I'm talking right now, I'm in pain and I have to kind of figure out how many, what's my battery like today? How many spoons can I spare today? Right. And so when we like, I know when I talk about breast cancer during this month, but also 365 days, a year, just like Keisha said, like we don't get a chance to step away and forget about it because the toxic treatments and the multiple surgeries. And I think people don't realize how much it rapidly ages you, the cancer, right? And then those treatments.
mhm,
And when you're constantly dealing with painful side effects every single day, and then also too, like my hair totally changed. Like I look like a very different person with this curly
mhm,
hair. The chemo curls, yeah, they're cute now because there's some length to it. But when they were coming in, it was like a chia pet. And I wanted my hair. Like, and so I think what people don't seem to understand is when you don't get to feel like yourself, and I don't like that word, that terminology, new normal. I'm like, none of this is normal. None of this is normal. But I've had to discover new routines and different
Mhm.
pathways in order to push forward. But I wish that we would see more and hear more and get more resources directed towards improving quality of life, because I want to, bring this up with Kisha, like thinking holistically. I have so many people say, well, why don't you just get acupuncture if you're in pain? And I'm like, well, my insurance doesn't cover that. And in order to make it effective, you can't just have one acupuncture treatment and be done with it. Like, it should be something that's consistent. And when cancer and, with Keisha being, the single mom and the breadwinner, me being a single woman, me, myself, and my cat Phoebe, um, it's a lot of pressure financially. And so I really wish, yes, we need dollars for, the newly diagnosed, we need dollars for our metastatic breast cancer community, but we really need more dollars invested into survivorship and how to help improve that quality of life, and like more financial resources and more holistic resources that are covered, or we can get grants to cover that, because we all deserve that quality of life. And it can be hard seeing these commercials and everyone smiling and everything when you're in pain and you didn't bounce back.
Mm-hmm. Yeah, definitely. I totally agree. I feel like every patient is different. Everybody, you can get the same treatment as like different people, and different ages, different performance statuses, and they will, um, maybe some will not feel anything, others will feel like fatigue and like, tiredness, depending on like whatever the side effects they experience, and it's different for everyone. So it's definitely always very, very difficult to, see and predict and, live through those shoes every day. So it's definitely difficult. Yeah. All right. So I guess in the end, like when we finish up, let's maybe end it with what are 3 things on your wish list, if you had, that you would want to see in the upcoming year. Let's make it like what has to be changed right now, not like in 5 years. It has to change within the upcoming year.
I guess for me, I would say, just piggyback off of what Megzi said, just focus more on survivorship.
Mm-hmm.
I it's nice to hear that people say, "Oh, you look good. Oh, but then it's not. It's like, okay, but I'm not okay.
Yeah.
You think that I'm okay, but I'm not okay." And I think that's how healthcare looks at you as well, too. Oh, you're doing good. Your labs are doing good. You're okay. Thank God for my labs doing good. Thank God for me continuously being in remission, but I'm not good. I don't feel like myself in a lot of areas and things. And I feel like I really wish that they would really focus more on preventative care for us, like a whole treatment plan to where when you are diagnosed, try to get everybody knows that medications cause side effects. So you know what a lot of these side effects are. Try to prevent some of these things,
Yeah.
beforehand. You know that side effects may cause what will cause bone pain, certain chemos or heart issues or things like that. Do give us the option to get things done preventatively, like, okay, that I'm on this chemo. Okay, well then start me on, give me a referral for physical therapy.
Yeah.
Also, see, cardiology to keep monitoring my heart to make sure
Yeah.
going on with that. Okay, now my mental. Put me in with, a referral for mental health. Things,
Mm-hmm.
know that I'm getting surgery. Have my body prepared for getting a
Yeah.
double mastectomy, beforehand by doing exercises beforehand,
Yes.
talking
Definitely.
nutrition beforehand, getting me increasing my vitamin C intake and vitamin E, things like that to help my healing process, so that after the fact I won't have to go through some of these things, because a lot of things that I did go through, I shouldn't have. They should,
Mm-hmm.
told me about them, and then gave me some options or resources to, try to prevent a majority of these things. So I really feel like a treatment plan, like we should have a whole team, not just oncology, primary care,
Yes.
and a specialist, but, mental health, nutrition, holistic health, and not feel shamed about going the holistic route, which I did, and I still am. And also my daughter, I'll speak to that briefly, but my daughter is a two-time triple negative breast cancer survivor as well. She was diagnosed at 28 and 29, and she
Mm.
chose the holistic route to have the lumpectomy and, have used the different herbs and different things of that nature. But she was shamed in that. And I think even that they need to start getting more educated in the holistic space, because more people are taking their health in their own hands. And just because you don't know about holistic, don't just throw it by the wayside, like, no, that's not, don't take that, you do what I want you to do type thing. So
I love that, Kisha. Yeah, it's exactly like you've been, Maxi knows how invested I am in survivorship. Like that's totally my goal as an oncologist, as I'm graduating and going to start soon being an independent physician. Like that's exactly my research focus, and that's exactly what I would love to see for my patients in terms of like, and also seeing how we can do better in terms of like, we need to do more research, right? As you know, at the end of the day, guidelines and everything, we have to like come down to like doing some research on how we can like work together instead of against each other. So I totally appreciate you sharing all this, how you feel, because that just totally resonates and furthermore empowers me to actually really invest my time and my interest to really pursue this, because I see that is so important for, patients, you guys. Like I feel like that really thank you for sharing. That was really powerful. And I think hopefully we get to work, continue our work together and collaborations down the road, right? One more question I wanted to ask with the recent trend of longevity, right? It talks about longevity, and you've probably heard like, like eat this, drink this, and then the infusions, and you see like med spas all over. How do you feel as a thriver seeing those things? Like, how do you just feel about like when healthy people like, or the whole trend is going on longevity? How do you guys take that, and how do you feel about that?
well, for me, I like it because I feel like that's what it is about quality of life. Yes, surviving, yes, being here, but I want to be here. I want to have a quality life. I want to have a productive life, not dependent on, a plethora of medications or just in a box. I want to enjoy my life. So I love things like that. And I really, even to speak to that, I really would like for them to, that's another one of my wishes. I don't know if that was three, probably more than that, but but I would love something, even so simple as that, because when we're going through chemo or sitting in the oncology office, a lot of times we're anxious, whether we're waiting to get our scans causing anxiety, or getting chemo, or just getting a follow-up appointment. Even something so simple as the lighting in the room, or or when you're getting chemo, turning the lights down, putting on some meditation type music. So many things like that. You'll be so surprised how, when your body is relaxed, how, much more you but how much more the body is receptive to the medications or to the injection, or whatever they're doing for you. But just to be calm sitting in the chemo chair, just, and that was like my envision of, when I was there, I would just kind of take myself away and just start listening to, the ocean and things like that. Maybe they can offer something like that to have, like the airplane, how they offer you the headphones to, like each little cubicle, each bay, you have your headphones that just, hey, what do you want to like how in the MRIs, how they ask you what type of music do you want to, like have that in the chemo space, or before you go in, if you want to come in 30 minutes before your appointment, here's our meditation room, things like that. So I love that. And just to say one more thing, I actually started providing Thrive boxes is what I call them for newly diagnosed breast cancer patients in my local community. And in those boxes, I just put, things like a blanket, just comfort items, just something that'll make you just, just be more comfortable. And I also put in there just different resources like meditation, like, if you're dealing with financial problems or mental problems or emotional or, anything like that. So I put a list of those resources in that box as well too, just to give them some options, just to decrease your, anxiety and how you're feeling as much as possible, because we all know that stress is a big factor in illnesses, in increasing your chances of getting certain illnesses. So,
Mm-hmm.
Well,
That's
I kind of want to piggyback off of that too. Um, the three things that I would really want, and I'm consistently hearing that we need more therapists who specialize in cancer patients. I am very lucky that I have an amazing therapist, a young guy, young white dude who is amazing, but he also has a background in being an oncology social worker. So he understands chronic pain. He understands the cancer patient experience. And so I think if we can develop more specialties gearing towards the cancer community, so when we are ready to tackle with our mental health, we can find more specialists who understand the experience. So that's one. And two, you know, to help with that quality of life, we do need more funding, more opportunities, more resources in survivorship, because within breast cancer, early stage breast cancer, they are seeing, increases in that longevity. But, when I think about our Black community, there's still something that's different within how things mutate in our bodies, etc. And so it's like we need more resources, because things can develop 5, 10, 15 years down the road, and what are they doing to help prepare for that as well? And then the third is just an acknowledgement of, this is not pretty, this is not easy, an acknowledgement on how this can be really debilitating. Whether you had chemo or you're on other like really tough medications, or you've had to have multiple surgeries, that messes with your memory, your short-term memory, as well. And so for some, we've had to leave careers because of those memory issues or debilitating side effects. And I wish we just had more resources to bring more, I guess, rest, because when you are the sole breadwinner of your
Mhm.
family, or you're single, so much falls on you. And then people are like, why don't you go here or go there? And it's like, okay, I have a job. I can't like go off and do all these things. I may only have one income, or maybe just two incomes, but what if, I'm waiting for the next shoe to drop? Like, I think we need more resources and just research in what survivorship life is like.
Mm-hmm. Yeah, I totally agree. And I really hope that more and more, efforts and funding efforts and things go into this. As much as we need treatment advancements, we also need to take care of our patients after they receive the treatment. All right,
Yeah.
on that positive note, we'll wrap it up for today. Thank you so much for your time, and I really appreciate all your true insights, and they were very powerful. Definitely had a little goosebumps and left me speechless sometimes. So I really appreciate your honesty and sharing the information.
Well, thank you so much. I'm so thrilled to be able to do this with Kisha. And also, again, just huge shout out to Oncology Data Advisor for even like giving us this platform to talk about these things, because so often there aren't as many places where we can be as open and honest and authentic like this. So really appreciate it.
Yeah,
yeah.
I definitely totally agree with you. And I feel like it's so important. Really, Oncology Data Advisor is doing great thing, because I feel like we need more of these in order that so that the industry hears it, the government hears it, as you said, the cancer policy advocates, you were, at the White House, like everybody needs to hear that we do need more support for our cancer thrivers, as well as we do need more insurance coverage too, right? The one that we have right now is very minimal. So we definitely really thankful to Oncology Data Advisor for that as well, to have this platform there.
Absolutely. And we're so appreciative of all of you for sharing your honest, authentic experiences, because that's what we need to hear. We don't need to hear the glossed over version. We need to hear what you're actually experiencing and what we need to know to help make this change. So thank you all so much today for coming on to share this. It's a great way to commemorate not only the awareness aspect of Breast Cancer Awareness Month, but the education and the action. So we really appreciate all of your perspectives today. So thank you again.
Thank you.
Yeah, thank you.